I'm Asia. I'm 27. I have a 2-year-old daughter, and I'm a third-year nursing student, and I'm just going to tell you a story. For as long as I can remember, my big sister has been my best friend, my protector, my idol. From the age of 5, I started stealing her clothes and copying the way that she did her hair. I wanted to be her when I grew up. When I was 12, everything changed, and I remember the exact moment that I stopped wanting to be like my big sister. The flashing lights from the ambulances and police vehicles that surrounded our house lit up my bedroom. I innocently went to investigate, was stopped by a police officer blocking the hallway. He told me to go back. Now, at that age, any adult is intimidating, let alone a big policeman. So, without a word, I nodded sheepishly, and as I turned, I happened to catch my first glimpse of the adult world. My mom was standing at the end of the hallway, a blank look on her face. She was covered in blood. It pooled at her feet, and I remember being surprised that blood looked so thick. See, up until that very moment, my mom had managed to shield me from the painful reality she'd been living the past 4 years, but the jig was up. Reality would be unveiled to me, and there was no going back. My big sister had been struggling, and since the onset of her symptoms at age 12, my mom, working multiple jobs, raising 3 little girls on her own, she did what she could to get her help. She exhausted every resource. Counselors, physicians, nurses, psychiatrists, social workers, you name it. No one seemed to hear the urgency in my mother's voice as she begged for someone to help save her little girl who was suffering in a way that was invisible. The responses were always the same. She'll grow out of it. It's ADHD. Here's a prescription. Let's follow up in a few months. So it went on like this. The years going by, my mom doing what she could to keep her 3 little girls happy, healthy, and alive, struggling just to keep her head above water. And then that day, when I was 12 and my sister was 16, she'd had enough of her pain, and so she went to the kitchen and grabbed the sharpest knife she could find, and she used it. Now, this wasn't a surface wound. This was not a clean incision. This was not a cry for attention, no. This was palm to bicep, vertically and then horizontally, all the way up both arms. I don't know much about what exactly happened that day, but I remember I didn't get to see my big sister for a while after that, and when we did get to go visit, she had staples holding her arms together. Life had changed for me that day, so I guess I was 12 when I knew I wanted to work in healthcare so I could learn how to fix my big sister. The years went on and we grew up, and my sister was never okay, but she was past the age of my mom being able to do anything. She'd get better for a while, and then she'd ruin Christmas by puking in everyone's luggage or leaving a pot on the stove and nearly burning the house down. Honestly, it became part of our family dynamic, and we were sad and worried and frustrated and annoyed. We've all had our fair share of fights with her, but we'd always make up, and she was always there with us, laughing, being her adorable, weird little self. And then when I was 23, I was 6 days away from my final exam, my very first year of nursing school, and I got the news that my sister had attempted suicide again, and she was in Vancouver Hospital. Now, we were kind of used to this, but something felt different. I can't explain it, and I know this sounds crazy, but we knew that it was the end. So with the same urgency that she'd become so familiar with, my mom begged the nurses and doctors assigned to my sister's care to keep her admitted. She could feel it in her bones that this was it, but as it goes, with few options available, my sister was discharged 2 days later. The next morning, hotel staff discovered a dead body, and we got the dreaded knock on the door from victim services. And I didn't take my last final exam that week. Instead, I walked into a dimly lit room where my big sister's body lay dead in a wooden box waiting to be turned to ash. I sat in that room and I listened as through tears my mother sang her childhood lullaby to the three of us before kissing that cold forehead and tucking her baby girl in to say goodnight for the very last time. She was 27 years old. I went to my doctor a few weeks later needing medication to manage my pain, and he said something that I'll never forget. In an attempt to comfort me, I think, he said, if someone really wants to die, they will. Well, maybe that's true, but all I heard was a poetic way of saying our system can't help people like that. It'll be 4 years this August since my big sister died, and now I'm 27. And as I get ready to enter into the nursing profession, I can't seem to figure this out. I've gone through it in my head over and over, every detail, trying to figure out what could have been done to help my sister, wondering if maybe that doctor was right, and maybe people with mental illness just can't be saved. Maybe a diagnosis of depression or bipolar is the equivalent to a stage 4 untreatable cancer diagnosis. But then it occurred to me that my sister didn't just wake up like this one day. No, it was a process over many years. And from the age of 12, there were countless medical professionals involved in her care. I can't help but wonder why treatment wasn't started before her symptoms were terminal. And the worst part is that this story is not unique. My sister's story is one in a sea of millions exactly like it. I've had the opportunity to speak with so many of my peers, and there's a crisis that runs deep within my generation. We're dying off at a rate faster than we can keep up with, and we need help. Our mental health is suffering to the point that an entire generation of young adults are losing the will to stay alive. We're losing ourselves. We don't know what to do. Nurses, doctors, all other healthcare professionals, please, we're begging you to hear the urgency in our voices. We aren't the experts, and the truth is, I wish I could tell you what we need, but I don't have the answers. I don't have any suggestions. I can't tell you how to help us. That isn't my job. My job is to stand here tonight and tell you this story from my heart in the hopes that maybe, just maybe, somewhere in this room, an idea will be ignited, and when my daughter or your daughter turns 12 and begins showing signs of mental illness, we can be confident knowing that there's help and that it's not terminal. Thank you.